Understanding skin ulcers in AIDS. A growing concern. Skin ulcers are a common problem. They can affect anyone, anywhere. But for people living with AIDS, these sores can be more than just a nuisance. They can be a serious health threat. AIDS weakens the body's immune system. This makes it harder to fight off infections. As a result, people with AIDS are more likely to develop skin ulcers. These ulcers can be painful, slow to heal, and even life-threatening. Understanding the causes of skin ulcers in AIDS patients is crucial. It allows us to provide timely and effective treatment. It also helps us to develop strategies for prevention. In the following sections, we'll delve deeper into the various factors that contribute to skin ulcers in AIDS patients. We'll also explore the diagnostic and treatment approaches that offer hope and healing. The invasion within infectious causes of skin ulcers. People with AIDS often develop skin ulcers due to infections. A weakened immune system invites various microbes. Bacteria, viruses, fungi, and protozoa can cause skin ulcers. These infections manifest differently, each with unique challenges. Common bacteria like Staphylococcus and Streptococcus often cause bacterial infections. These can lead to painful pus-filled sores. Herpes simplex and varicella zoster viruses also cause ulcers. These present as painful blisters or chronic lesions. Fungal infections like Candida cause itchy rashes that may ulcerate. Protozoal infections, though rare, can also cause ulcers. Leishmaniasis from sandfly bites causes disfiguring ulcers. When cells turn rogue, malignancies and skin ulcers. Beyond infections, certain types of cancers can also manifest as skin ulcers in AIDS patients. These malignancies often target the skin cells themselves, leading to abnormal growth and ulceration. Kaposi's sarcoma, a cancer that develops from the cells that line lymph or blood vessels, is a prime example. KS often presents as purplish or brown lesions on the skin, which can develop into ulcers. Lymphomas, cancers of the lymphatic system, can also affect the skin. These cancers can cause a variety of skin manifestations including nodules, plaques, and ulcers. The development of these malignancies is often linked to the suppression of the immune system caused by AIDS. Without a robust immune response, these cancerous cells can multiply and invade healthy tissues, leading to ulcer formation. Early diagnosis and treatment are essential for managing these malignancies. Treatment options may include chemotherapy, radiation therapy, or surgery depending on the specific type and stage of cancer. The body against itself. Autoimmune and inflammatory causes. In some cases, the body's own immune system can turn against itself, leading to a range of inflammatory conditions that manifest as skin ulcers. This is particularly true in individuals with AIDS, whose immune systems are already compromised. Vasculitis, a condition characterized by inflammation of the blood vessels, can cause skin ulcers. The inflammation restricts blood flow to the skin, leading to tissue damage and ulceration. Pyoderma gangrenosum, another inflammatory condition, causes painful ulcers that can rapidly expand. The exact cause is unknown, but it's thought to be an autoimmune reaction triggered by an injury or infection. These autoimmune and inflammatory conditions can be challenging to diagnose and treat. Treatment often involves suppressing the immune system with medications like corticosteroids, which can be tricky in individuals already dealing with a weakened immune system due to AIDS. It's important to note that while these conditions are less common than infections as a cause of skin ulcers in AIDS patients, they highlight the complex interplay between the immune system and skin health in these individuals. Section 5. Beyond infection. Other factors at play. Infections, malignancies, and autoimmune conditions are major contributors to skin ulcers in AIDS patients. Other factors can also play a significant role. Drug reactions are a common culprit. Medications, including those for HIV, can cause skin reactions leading to ulcers. Pressure ulcers are another concern for those with limited mobility. Constant pressure restricts blood flow, causing tissue damage. Nutritional deficiencies impair wound healing and increase ulcer risk. Deficiencies in vitamins like C and zinc slow down repair processes. Iris can also manifest with skin lesions, including ulcers. Managing skin health in AIDS patients is complex. A holistic approach is often required. Section 6. Unraveling the mystery, diagnosing skin ulcers in AIDS patients. Diagnosing the cause of a skin ulcer in an AIDS patient is like solving a puzzle. It requires careful consideration of the patient's medical history, a thorough physical examination, and often a series of laboratory tests. The doctor will start by asking about the patient's symptoms when the ulcer first appeared and any recent illnesses or medications. They will also examine the ulcer closely, noting its size, shape, color, and any discharge. Laboratory tests can help identify the underlying cause of the ulcer. These may include skin culture, where a sample of the ulcer is taken and tested to see what type of bacteria, virus, or fungus, if any, is present. Blood tests, which can detect signs of infection, inflammation, or other underlying conditions. And biopsy, where a small piece of the ulcer is removed and examined under a microscope to determine the cause and rule out malignancies. Accurate diagnosis is crucial for guiding treatment and ensuring the best possible outcome for the patient. Section 7. A team effort. The importance of multidisciplinary care. Managing skin ulcers and AIDS. Patients often requires a team effort. Doctors, nurses, pharmacists, nutritionists, and other healthcare professionals may need to work together to provide comprehensive care. The primary care physician plays a central role in coordinating care and managing the patient's overall health. They may refer the patient to specialists, such as a dermatologist or infectious disease specialist, for further evaluation and treatment. Nurses provide wound care, administer medications, and educate patients on how to manage their condition at home. Pharmacists dispense medications and counsel patients on potential side effects and interactions. Nutritionists play a vital role in ensuring patients are getting the nutrients they need for wound healing and overall health. They may recommend dietary changes or supplements to address any deficiencies. This multidisciplinary approach ensures that all aspects of the patient's care are addressed, improving their chances of healing and preventing future ulcers. Section 8. The power of prevention. Reducing the risk of skin ulcers. Preventing skin ulcers in AIDS patients is just as important as treating them. Good hygiene is paramount. Wash hands frequently, shower or bathe daily, and keep the skin clean and dry. Wear comfortable clothing and protect the skin from injury. Maintain a healthy lifestyle with a balanced diet and regular exercise. Regular medical checkups are essential. These measures help reduce the risk of skin ulcers and maintain healthy skin. Section 9. Living with skin ulcers. Tips for management and care. Living with a skin ulcer can be challenging, but there are ways to manage the condition and improve quality of life. Proper wound care, pain management, and emotional support are essential. Wound care typically involves cleaning the ulcer with gentle soap and water, applying prescribed medications or dressings, and keeping the area clean and dry. It's important to follow the doctor's instructions carefully and avoid using any home remedies without first consulting them. Pain management is crucial for improving comfort and quality of life. Over-the-counter pain relievers like ibuprofen or acetaminophen may be sufficient for mild pain. For more severe pain, prescription medications may be necessary. Emotional support is also essential. Dealing with a chronic condition like a skin ulcer can be stressful and emotionally draining. Talking to a therapist or counselor, joining a support group, or confiding in loved ones can provide much-needed emotional support. Remember, living with a skin ulcer doesn't mean giving up on life. By taking an active role in managing the condition, individuals can minimize its impact and live full and meaningful lives. Section 10. The future of treatment, emerging therapies, and research. The field of medicine is constantly evolving, and new treatments for skin ulcers in AIDS patients are on the horizon. Researchers are exploring innovative approaches that hold promise for improving healing, reducing pain, and preventing recurrence. One promising area of research is the development of new topical therapies. These therapies, applied directly to the ulcer, aim to promote healing by stimulating cell growth, reducing inflammation, and fighting infection. Another exciting avenue is the use of biologics. These medications, made from living organisms or their products, target specific components of the immune system to regulate inflammation and promote healing. Stem cell therapy is also showing potential for treating chronic wounds, including ulcers. Stem cells, with their unique ability to differentiate into various cell types, can potentially regenerate damaged tissues and accelerate healing. While these emerging therapies are still in various stages of development, they offer hope for more effective and targeted treatments for skin ulcers in AIDS patients in the future. Section 11. A call to action. Improving care for AIDS-related skin ulcers. Skin ulcers are a significant health concern for people living with AIDS. These wounds can be painful, debilitating, and even life-threatening if left untreated. While we've made significant progress in understanding and managing HIV/AIDS, addressing the issue of skin ulcers requires a concerted effort. Healthcare providers need to be vigilant in screening for and treating skin ulcers in their AIDS patients. Early diagnosis and prompt treatment are crucial for preventing complications and improving outcomes. More research is needed to develop new and effective treatments for skin ulcers, particularly those that are resistant to conventional therapies. Investing in research will lead to breakthroughs that can improve the lives of countless individuals. Finally, we need to raise awareness about skin ulcers in AIDS. Educating patients about the importance of preventive measures, early detection, and proper wound care can empower them to take control of their health. By working together, we can make a real difference in the lives of people living with AIDS and help them achieve healthier skin and a better quality of life.